My name is Joe Murray. I'm a gastroenterologist at the Mayo Clinic in Rochester, Minnesota, and I'm going to be discussing an article entitled Blockers of Angiotensin Other Than Olmesartan in Patients with Villous Atrophy, a nationwide case control study. My colleagues and I from the Karolinska Institute in Sweden and in Columbia University in New York City have examined the question of whether certain antihypertensive drugs may be associated with damage in the intestine. Previously, in the proceedings, we reported an association between the use of a particular angiotensin receptor blocker, olmesartan, and significant injury in the intestine producing villous atrophy and a severe diarrhea-like disorder. Was this association limited just to olmesartan? And to address this, my colleagues and I utilized a unique data resource in which there's all of the patients, or virtually all of the patients with villous atrophy on biopsies from the intestine in Sweden are linked to the medication register in Sweden. Now, Sweden is interesting because they have lots of angiotensin receptor blockers as well as ACE inhibitors, but they don't have olmesartan. It has not been available in Sweden. And this study showed that there was no increase in association between the presence of damage to the intestine on biopsy with villous atrophy and the prescription for angiotensin receptor blockers or ACE inhibitors that were available in Sweden. Even when correcting for multiple prescriptions or repeated prescriptions for angiotensin receptor blockers, there was not a significant association. Now, what do these results mean? Well, these results mean that at least in a large country like Sweden, where we know a lot about drug prescriptions and we know a lot about the people who have damage in their intestine on biopsies, there was no apparent association of the other angiotensin receptor blockers and damage. It is possible that perhaps there needs to be a longer duration of follow-up in order to detect a signal. It's also possible that the numbers of people affected by damage to the intestine who might not have celiac disease might be too small to detect such a difference. Nonetheless, I think we, as clinicians, we can interpret this as being reassuring. If you have patients on angiotensin receptor blockers, certainly anyone that are available in Sweden, one should not be concerned about an association with intestinal injury. The strengths of this study really rely on the large databases available in Sweden. The first is a very large database assembled by our colleague Jonas Ludvigsson and his colleagues at the Karolinska where they've aggregated pathology findings suggestive of celiac disease characterized by villous atrophy from almost all of the major pathology departments in Sweden. And secondly, the medication register, which collects over 99% of all prescribed medicines for residents of Sweden. This allows being able to cross-reference these two databases is extremely powerful method for determining associations. It should be known, however, that association does not equal cause, though its absence suggests there can be no causal relationship between angiotensin receptor blocker use, ACE inhibitor use, and the presence of villous atrophy, at least in Sweden. Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.